Buongiorno.
Good afternoon. Welcome to this session whose title is New Healthcare Systems in the World After the Pandemic. The aim of this session is not to look back and to dwell on the debates and polemical stances that are still on, but we want to look at the future. We want to understand where we're going. That is why we have organized this international session. Here with us, there are two distinguished experts at world level. First of all, Professor Amitabh Chandra, who is an economist, is a professor at the Harvard Business School and is director of the policy research at the Harvard Kennedy School of Government. So he is really a great expert of the U.S. healthcare system and world healthcare systems. We thank him so much for being with us, and this round of applause is for you, Professor Chandra. Then we also have Mr. Walter Ricciardi, President of the World Federation of Public Health Associations, full Professor of Hygiene and Preventive Medicine of the Catholic University of the Sacred Heart in Milan, and one of the greatest players in the fight against COVID-19 in Italy. This round of applause is for you, and we want to thank you for your presence and for the great job that you've done. And then next to me is Minister Roberto Speranza, Minister of Health in Italy, who has also been in the front line, and we would like to thank him very much for having him here with us today. I would like to give you a brief introduction about the new health systems. We're going through a slide presentation. The first picture is about Egypt, so we started really back in time. And then I also want to show you the meter, the Paris meter, that was designed in 1889. And soon after this, you see this picture of the coronavirus. And this coronavirus, the size is about 50 nanometers and 140 nanometers. This is 1/1000th of a meter. So let's go back for a second. So this very, very small entity, which is 600 times smaller than the diameter of hair, human hair, collapsed world health systems and caused all the things that it caused. So just imagine what it means for healthcare systems to try and imagine the future, what we are dealing with. Because we know what happened, but the crisis affected world health systems wherever. And so that is why we're asking us these questions, what it means after this entity, after the coming of this entity, what does it mean to ask ourselves, how can we go on? This is a very small entity, but very powerful one, which led to a profound crisis of healthcare systems. So the question is, what was missing? So I'm just going to mention some provocative statements to let then our distinguished speakers reflect on them. So what is needed? Resilience is needed to prepare to new emergency, guarantee services during crisis, learn from experience, and reorganize things after a crisis. Why am I saying this? Because we're told that it may not be the last time. It already happened in the past, and so we should get accustomed to this new kind of way of dealing with illnesses. What this disease taught us is that we need a new social health. We were used to go to the doctors individually, but now the behavior of each individual in daily life and relations with people may affect other people's health. We saw it here at the meeting. You need a green pass to go through entrance checks, and if you don't have it, you have to take a test, because otherwise you may put at risk everybody's health. That's a new system already to conceive healthcare systems. Then we have to move on and go beyond protocols. Experts tell us that a patient of with COVID is not the same as another patient. Features of patients are very different from each other. So doctors, physicians must be ready not just to apply protocols, but also ready to innovation and to change. And then we have the relationship between the hospitals and the community. We were used to go to the emergency service, at least in Italy, maybe in the US it's different, and we've now learned that the preventive health network with the GP and integration between primary and secondary healthcare systems is more and more important, as much as it is fundamental to focus on the role of health operators. Their professionalism should change. They have to develop more skills. It shouldn't be just about bureaucracy, but the whole system should have the ability to cure patients. And also, there is the role of technologies. Digital medicine, telemedicine makes it possible to manage things from a distance. We had a big debate on tracing, for example. And then there is also the issue of the relationship between the center and the periphery. And in Italy, we have the whole issue of the relationship between regions and the central state. So it is clear that all these points are fundamental. I would like to just give some examples of Italy. We used to be considered the bel paese for healthcare system. We had the third place for life expectancy, the second healthcare system in the world, according to WHO, with free healthcare for all and great excellence in cure and research. Is this still the case, or has this been hindered entirely? Because we have found some limits, for example, that the per capita expense is below the average at EU levels. There is a big gap at the community level, and also even in the best places we saw that there was not enough preparation to manage the pandemic, and that the changes were slow. For example, in per capita expenses is shown in this chart. You can look at public spending. Here you see the trend over the last few years over the GDP. Considering this figure, we see that in Italy, the healthcare spending is 8.5% of GDP compared to the general European average of 9.9%. And there are 4 GPs every 1,000 inhabitants compared to 3.2 in France and 2.9 in the UK. So why so many doctors and so little spending? It's an open issue. And then there are some challenges, in particular for our country, in addition to the world situation. This is the balance between hospitals and communities, the role of the GPs, and the new technologies, virtual education and behaviors, the relationship between center and periphery, science and politics, science and communication, and so on and so forth. So you see that we should not just look back and think about tests and green pass. It is fundamental to look forward too. That is why the questions that I would like to ask our guests are these. First, there is a question for a short answer, about 10 minutes, that is the positive and negative features of current healthcare systems. And so, Professor Chandra, I would like to invite you to tell us about the US system and the systems internationally, and also Walter Ricciardi is invited to expand on this. And then we'll hear from the Minister of Italy. And then the other questions is about the future. How can we deal with new diseases, new pandemic, and what prospects for new healthcare needs in the future? So the floor goes to Professor Chandra to answer the first question, so to see what has happened, and then we will go on about the future. Thank you, Professor. You have the floor, and we thank you once again for your presence, which is an honor for us at world level in this meeting of Rimini.
Giorgio, it is wonderful to see you, and I am sad that we are not able to see each other in person this year, but I look forward to embracing you when it is safe to do so. I think, you know, if you ask me to think about what we're up against right now, one way to start that conversation is to look at just the economic loss, and then we can talk about the health loss. So let's just start with the economic loss. In the United States, the Congressional Budget Office, which is the federal agency that looks at the federal government's budget, estimates that the United States will lose about $8 trillion in the form of lost wages, lost production, less consumption as a result of this pandemic over the next decade. $8 trillion. So that's eight. Not with that's 8 with 12 zeros. That's the American number. Now, someone might be saying, what is $8 trillion? It sounds this 8 trillion is not a unit that most people are used to grappling with. So $8 trillion is about, it's about 4 times larger than all the economic losses that we suffered in the Great Recession of 2009. It is more than twice what the United States has spent in all the wars that it has fought since 9/11, including those in Afghanistan, Iraq, and Syria. And a third way to think about this number is it is approximately, 8 trillion is approximately the estimate of damages from 50 years of climate change, right? So if you think about decreased agricultural productivity, severe weather events, you'll get about $8 trillion, right? So what we are living through is orders of magnitude larger than any other headline that the media may be reporting on, and that seems to be captivating us. Now, I've only talked about the economic loss, but the reason we're here is because of the health loss. So if we count the premature death, the long-term health impairments, the mental health impairments, economists like Larry Summers and David Cutler estimate that the total loss, economic plus health, rises to over $16 trillion. $16 trillion is about a year of US GDP. So if you think that the US experience scales to the rest of the world, and the rest of the world's GDP is about $80 trillion, and the US economy is about a fourth of the world GDP. If you believe all of that, the loss is about $60 trillion as a result of this pandemic. And the reason I wanted to start with that number is it seems like everything we have done as a country and as a planet is so small, it's so timid relative to the catastrophe that the planet is living through. I mean, if you had approached any OECD government 5-10 years ago and said, guys, you're going to face a $60 trillion output loss with some probability, 1 in 100. There's a 1 in 100 probability of facing a 60 trillion loss, how much would you be willing to spend to avoid this? Would you be willing to spend, 100 billion, 200 billion, 500 billion, a trillion? The answer would be no, we don't have the money, right? But we have learned that that kind of thinking is incredibly myopic, is incredibly dangerous, is incredibly timid, right? We've been willing to spend billions, but we are spending it really, really late. So I'm going to wrap up, Giorgio, before I get to ideas, and say there is a timidity that haunts the budget people, in Washington, in Rome, in London. There's just a timidity that we must start with how much money we have, instead of thinking about the benefits of investing much more in research, in prevention, in treatments, in science, and in vaccines. And we are paying dearly for this. So if you think that these events happen even once in 100 years, you said the last time this happened was 1918, you should be willing to spend 1/100th of $60 trillion every year. That's a colossal amount of money. And if you think that because of SARS and MERS and Ebola, the probability of these catastrophic events is not 1 in 100, but 1 in 10, we should be willing to spend about $6 trillion a year as a planet investing in public health, in science, in research. And I worry greatly that anybody who says we don't have the money to do that is really not fit, to kind of manage the well-being of society. And most importantly, the well-being of the sick and the poor, because they have no voice. The people who have voice are those of us who are here today, who are healthy, who are rich. We have an obligation to be doing much more for the rest of the world. So I'm going to stop over there.
Bene, passerei la parola al professor Ricciardi.
Very well. I would like to give the floor to Professor Ricciardi. This session is streamed online on the Corriere della Sera newspaper website and the website of the meeting.
Thank you. I hope you can hear me well. I totally agree with what Mr. Vittadini and Professor Chandra have said. What I can add from my vantage point is that as president of the WFPHA, so all the public health society in the world, representing more than 5 million workers of this sector, is that out of 200 countries existing in the world, not one has health system that is similar to any other one. So each healthcare system in the world is pretty unique in terms of structure and features. So we can only talk about national responses. And I do agree with what Professor Chandra said. We were all totally unprepared to tackle the situation. Nobody was ready, not even to tackle the increasing number of chronic diseases, and the pandemic just worsened things, and especially as far as vulnerable people are concerned. It is impossible to make specific examples, but there is Milton Romer, an American expert, that classified these 200 healthcare systems in 3 categories, and we can understand quickly the difference. The first category, the most common one, is the so-called Wild West category, where citizens have to pay for healthcare services. The vast majority of the countries in the world has no universal system, so a poor person has no resources to pay for healthcare services, and that applies even more now. So even before the Obamacare, and the U.S. had this kind of model, so a private commercial healthcare system. Then you have other countries that have another model, the so-called social insurance model. So Germany, France, the vast majority has this kind of system. So you have a universal coverage through an insurance. And then if people are unemployed or poor or deprived, the state intervenes. But basically, service providers are private operators, so you pay and then you get reimbursed. And then there are other countries like the UK, Sweden, Denmark, and Italy, but there are fewer and fewer that have a national healthcare system. So you just need to be a citizen of that country. That's what you need to have access to these services. Nobody will ever ask you for a credit card or a social security number. So that's it. So no social class distinction. But why are these countries getting fewer? Well, first of all, because of the economic crisis and of the epidemiological transition. Well, the response from these healthcare service systems is very problematic, especially for the decentralized ones like Italy and Spain. And, well, the ministers often talk about investments made in the healthcare sector. And, he's present. I don't want to praise him, but he found more resources over this lapse of time than all the previous governments of the previous 10 years. So, as Professor Chandra said, in an emergency condition, but too late, resources were found. But these resources alone are not enough. You need to spend all of the money. And which are then the investments that lag behind? First of all, working conditions and the wages of healthcare staff. So Professor Vittadini showed a number. So it seems that we have more physicians than France and other countries. But, well, if we look at Italy, the number of nurses that we would need to have, for instance, the number of nurses that we have in Germany, well, should be increased by 35,000 to 50,000. So we have been pretty sort of unconsidered in the past. So now we should learn from what happened. We need to invest more in the healthcare sector without any hesitation. But unfortunately, nobody is ready to do so, not in Italy and not anywhere else in Europe, because we spend for other things and we spend just for essential system services in Italy. And also we need to reorganize and restructure our healthcare services. But I think we are going to talk about that during the second round of questions. Thank you. Minister, the floor is yours. Thank you. First off, thanks for the invitation and this possibility to have a dialogue with such two sort of high-flying experts that I esteem very much. First of all, I think that we have to defend as much as we can our model, so a universal healthcare system. Article 32 of our Constitution, in a very few words that are pretty bright, in my opinion, indicates that the road that we should follow. So if you read this article, well, it is pretty short, but the words are very clear, and they tell us very clearly where we have to go. So the state protects the health of the citizens for the interests of individuals and of the collectivity, and guarantees care and treatment also for the most deprived and poorest in society. And I think that this is more than enough to define any program, and the words chosen, so the wording was not chosen by chance, not at all. It's not trivial at all. And so the words right and fundamental are written together. So it's a fundamental right the Republic safeguards health as a fundamental right of the individual and as a collective interest. And at that time, there was a debate. Some people proposed to use the word citizen, some proposed to use the word worker. Well, in the end, the choice was for the word individual, because it covers the largest number of people, because individual equals human being. And so behind that choice, there was the idea of a universal healthcare system. What does universal mean? I think that this means the most beautiful thing of our human heritage, that if a person is sick, if an individual, if a human being is sick, it doesn't matter how much money this person has. It doesn't matter where this person comes from or the color of the skin. This person has the right to be treated and taken care of. This is a fundamental right that we have to desperately defend and protect. And that's how Italy built its national healthcare system. So this is the sort of laying foundation that was set by our sort of constituency fathers. And well, this is a principle, but reality sometimes is hard, and we need to work every day to translate this principle into reality and to getting it closer to the life of people. And to do so, we need first and foremost resources. And this is the most decisive thing. Well, we cannot bark around the bush. I mean, unless we restart investing with all the energies we have in our national healthcare system, it will get harder and harder to stick and comply with those words in our constitution. I just want to add some figures, but I also want to make a preliminary remark. COVID made us learn a lesson that is very important, and the words of Pope Francis should be considered as a warning. When in St. Peter's Square, during a rainy day in the spring of 2020, he said that there is nothing worse than this crisis than wasting it. And we should not waste the occasion offered by this crisis. So we have learned that there are fundamental things, and among these things there is the right to health. So when I was appointed as a minister, it was September 2019, and I remember that there was a finance law that had just 1 billion more under the chapter National Healthcare System that was available. So there was just 1 billion euros more. And I remember that at that time, we were able to rise that amount to 2 billion euros. It was 2019. And well, you know, regional governors were happy. They said, oh, wow, we have 2 billion this year. We have doubled the amount available for the healthcare system. And then COVID arrived. And in 2020, we had to allocate additional 10 billion, 6 as a regular sort of expenditure, plus another 4. And now we have the National Resilience and Recovery Plan, which is pretty tangible, that gives us fresh money to be used for many, many things. And 20 billion are going to be invested in our national healthcare system. So let's have a look at this snapshot. So in 2 years' time, not in 10 years' time, in just 2 years' time, and not because, we have Mr. Draghi as Prime Minister, but simply because all the people, when faced with the tragedy brought about by COVID and faced with the very high price that everybody paid because of COVID, well, became suddenly aware of the fact that we needed to invest again in our NHS. And if there is one thing it's worth investing, it's our NHS. It's the idea and the principle of a universal system. Okay, many sectors need investments, but this is about a cultural leap. I mean, we really need to realize that. Allow me to say that very frankly. For too many years, for too long, budgets and Excel files decided how much health could be protected. Now COVID has encouraged us to reverse this trend. I mean, it's not a budget that has to decide, it can decide how much health of the individuals can be protected. It should be the other way around. And COVID made us make that change, this radical change. We're still in the middle of the pandemic. We need to, keep vigilant and alert. But we have entered a new phase. We have different weapons now. I'm thinking clearly about the vaccines that are helping us managing better and differently the situation. But now we really need to learn the lesson learned over the last 18 months and start daring to invest more in our NHS, because the right to health is really the most important thing we have, and we need to protect it with any possible means. I really want to reaffirm that, and for me, this is very important. Very often, I talk to ministers from other countries in the world. In a few days, very, very shortly, we are going to have the G20 in Italy. Italy has the presidency. We're going to have the 20 ministers of health of the most, let's say, economically important countries in the world. Some of these countries have a different model. And if you're sick, unless you have a credit card or an insurance, or you cannot have access to treatments. The Italian model was built on another approach. So if an individual is sick, that individual has the right to be treated and cured regardless of their economic resources and prosperity and money. And this is something we really have to protect and defend with any means we have available. I study human capital, and human capital is made of two things: education and health. And unfortunately, when it comes to these two things, very often they are considered not so important. These two things are considered as a social expenditure, item, and not as a key investment in society. Instead, we have understood from our three guests that this is a key investment. If you not invest, you cannot build that. It's not just about infrastructure. Well, first of all, individuals need resources, and these resources are key for their survival. And regardless of the class, origin, because the right to health, as well as the right to education, are basic fundamental rights that make up the I that is at the center of this year's meeting. So how can we spend money for the future? I was very much struck by what you said, Professor Chandra, when you said that these crises, could happen once every 10 years, not once every 100 years. So how can we tackle new diseases? What are the perspectives for our system? Professor Chandra, the floor is yours again.
That was a great discussion, and I very much have the view that spending on human capital is an investment. Spending on health is also an investment. But to me, and I'm speaking maybe not as an economist in saying this, spending on health, in addition to being an investment, is something more. I think it's the right thing, the decent thing to do. So, more than, even if it were not an investment, I feel like we have an obligation as a decent society to care about those who have less, in the sense of those who are sick. So I come at this from a sense of social justice, as well as a sense that this may be an investment. Now, what can we do about it? I think where countries like Italy lead, where countries like UK lead, is you've already taken on the first challenge, or you're trying to, right? Like, I think these ideas that are crystallized in your constitutions around universal healthcare are things that the US still has to catch up on. So you are much more ahead of us in terms of universal coverage. But as was noted earlier, that's not enough. Even if we did universal coverage for everybody, and generous universal coverage, excellent universal coverage for everybody, it's still insufficient. We will still get diseases coming to us. There will still be genetic mutations and suffering, even in a world with very generous coverage. So we have to think about how, the question that should be before us is not how do we get universal coverage. That's important. I don't disagree with that. It's how do we reduce human suffering. That's I think what we should really care about. And universal coverage is one very important piece to that. But there's also, I think, much more that we need to do in terms of scientific research that can give us insights which result in better treatments, better epidemiology, better prevention, and maybe from time to time, better vaccines, right? So I'm not saying the answer is only in vaccines, so that's not where I'm going. But I think we want to live in a world where it's not just that people have universal coverage, but that when they have a terrible disease like diabetes, it's not just that we cover the insulin and we say, oh, you know, Amitabh or Giorgio, you have diabetes, your insulin is paid for. That's good. That's much better than what we have in the US. You have that in Italy. But I think that that's good. It's not great. What I think we want is a world where someone has diabetes and we have a cure for diabetes. Insulin is not a cure for diabetes. Insulin is an expensive treatment. It allows me to live till I'm 80 or 90, live a normal life, meet my family, see my children, experience life, but it is not a cure. I still live with the burden of diabetes. I think what we need to be thinking about is what kinds of investments in transformational public health are we capable of as a planet, as a group of scientists? So I think what we want to be imagining is a world where when someone has diabetes, we figure out how to reprogram the stem cells that live in their bone marrow to regenerate as beta cells in their pancreas. And so their pancreas goes back to secreting insulin. I don't have to give you insulin. Your pancreas is now able to produce insulin. When a child is born with spinal muscular atrophy or Usher syndrome, I don't want it to be the case that, you know, we have universal coverage and we're giving the same lousy treatments for SMA that we have today, but that we have a cell or gene therapy that can, in principle, cure that disease. So that is going to require more investment in science, particularly for diseases that the first world, the rich world, may not have. So last year alone, something like 600,000 children in West Africa died of malaria. The world does not have a great cure, a great vaccine for malaria, but that's only because there isn't a lot of malaria in America, in Canada, in the OECD, which is sad. If we invested in a malaria vaccine, right, we not only get the investment benefits of that discovery, you know, that we might be able to kind of raise a lot of Western Africa out of poverty, but we've just reduced the terrible, crippling suffering that children around the world have when they have malaria. So I think that one of the things that COVID has taught me is, at least as an American, America has to think about learning from other OECD countries on the importance of universal coverage. But America also has to remember that that is not enough. We need a much more courageous investment in basic sciences with an eye to curing disease or through primary prevention, removing it completely. And I hope that that is one of the lasting legacies of COVID on us. Because even before COVID, we knew we had to do universal coverage. But after COVID, I think one thing I've learned is we just need much more courageous investments in transformational public health and transformational medicines.
Parola a Walter Ricciardi.
Now the floor goes to Mr. Ricciardi. I would like to link up with what Professor Chandra said about diabetes to make you better understand, the difference between our healthcare systems. Because, with diabetes of type 1, so the diabetes that prevents a human being from secreting insulin, you have a treatment that costs between $400 and $450 a month. So if you're covered by insurance, you get that money from the insurance. If you have not an insurance, you have to pay for that. And in the UK or in Italy, this is unthinkable. So if a child is born with diabetes, so that makes a lot of difference. And then you have type 2 diabetes that is also treated. In the US, there was a boy, the child of a single mother, that was able to live up to 25 years of age because he had the insurance of the mother. After that age, he died within 1 year because basically it was not covered any longer by his mother insurance, and so he could just have little jobs. So you see, this makes a difference between death and life. So this is up to in single countries that they have to get self-organized to provide answers to their citizens. But there are three things that is not possible to do alone. We need an international alliance. And Italy is certainly playing a key role in that, the minister first off, not only within the G20, but also when it comes to reorganizing the WHO. And I want to underscore that Italy was one among the first 20 countries that highlighted the need to have a new global pandemic treaty in order, first of all, to get out of this situation, because we are not out of that, not yet. And if we do not act, well, we won't leave it behind. And there is a proposal of the World Federation that I want to share with you in a second. There are three phenomena: climate change, the pandemic, and the international migratory flows that can be managed only through international treaties. So we need a new global international treaty on the pandemic. We need to avoid what happened with the Indian variant. So what happened? The Indian government somehow did not comply with the specific duties. So it let it circulate, not forbidding the gatherings along holy rivers. So those millions Indians that celebrated their holy festivities close to the holy rivers made these very contagious variant circulate, even outdoor. So the viral charge is 1,000 times more than the Wuhan variant. So you just need to get closer to an infectious person, even outdoor, to get infected yourself. And that was India. And then for 2 weeks, while the rest of the world had blocked and stopped flights to and from India, the UK kept the flights on to and from India and to and from Pakistan. So we need to put a stop to that through international agreements. Moreover, we need a world information system. I'm very, very happy, and I informed the minister of that, and he accepted this proposal, that the WHO, September 1st, so next week, will inaugurate the first World Center for Pandemic and Epidemic Intelligence. That was possible thanks to an investment of the German government, 30 million euros. The center will cost 150 million euros, and the other countries will pay for that. And the minister intends to reinforce this kind of intelligence system by connecting to that center. I just want to end up on another note by sharing with you what, in my opinion, is the only way to get out of the pandemic. So there is the HIV pandemic that has been going on for 15 years. It started in 81. And it was ended because very effective drugs were created in the 90s. But these drugs were very, very expensive. So the poorest countries in the world, first of all, South Africa, at that time, Nelson Mandela was the president, could not afford them. Mandela and Kofi Annan proposed what the World Federation is proposing today. That's the only feasible sort of way out. The temporary suspension of patents and the authorization to technological transfer to producers' drugs. Today, there are countries that produce vaccines, but only for rich countries. We have, for instance, used 4 billion vaccines. But the vaccines that are manufactured in the south of the world then go to the north of the world. We need 10 billion doses of vaccine by 2022. Otherwise, we will never get out of this. So the example of HIV should somehow enlighten us so that we can get out of this as soon as possible. So the vaccine as public health good is key, as well as a reform of our healthcare system. So I think that this is what future is about.
Prego, Ministro.
Sì, io condivido molto.
I share many of the things that I've heard, and I would like to add an observation. If I think of the future national healthcare system of the future, I think that the first challenge concerns persons, the men and women that work in the hospitals every single day. I would like to thank them all for the extraordinary work that they have done over the last year and a half. They've been fantastic. And we should not never forget what all these operators have done. And it is clear that we must be aware that new investments in the new healthcare system should concern the men and the women working in the national healthcare system. As minister, in these months, I've been through a contradiction that I want to share quite candidly. On one side, at one point during the pandemic, in the country, there was a sort of narrative of the heroes when people talked about the physicians and the clinicians and the nurses. They used to refer to heroes. On the other side, however, in Italy, there was a law that for 15 years blocked the resources that regional authorities could make as investments in those people. Compared to that, in 2004, minus 1.4%. That was an unbearable contradiction. On the one side, we had the narrative of the heroes. On the other side, we had this law that lasted 15 years that was a straitjacket. So the regional authorities that are in charge of health resources in Italy could not invest more. They had to go back to the levels of investment back in 2004, minus 1.4%, and that was the threshold that they were not allowed to overcome. That's the reality we have to deal with. So when we say that a new season of investments must be open, and when we say, as we said before, that every single euro that is invested in healthcare system is not just public spending, it is the greatest investment in the quality of life of people, then what is needed is the strength to change, for example, the laws. Then more on personnel. I think that the question of personnel is fundamental. In the most dramatic days, Walter was often with me in the civil protection headquarters. We bought masks, we bought respirators, and there is an international market that helped us because at difficult times we received cargoes from other parts of the world that were helping with the materials that we'd bought. We could buy coats, we could buy masks, we could buy respirators, but what about a clinician? A clinician, either you have educated him or her, or you don't have him or her. So the investment is a long-term investment. That means more scholarships for specializations for those interested in pursuing that career. And I want to say this softly because I think that reality imposed our choices now. But if you look at the scholarships that were funded over the last few years, 2017, 2019, there were 6,000 scholarships per year. Last year, we reached 13,400, and this year, 17,400 scholarships. That is the double and 3 times as much compared to some years ago. So that means that this blow that we got from COVID make many people understand that this point is really important and investments are needed in this. And if I think about the healthcare systems of the future, this is the first point. We have to invest in the people, in the men and women working in healthcare systems. And Walter said something right before. We cannot really afford to have an educated young person who goes to work abroad because he or she finds better conditions. This is a big issue in Italy, and we have to invest even more in Italy. And at long last, we are having some results in this respect. And then if I think of the healthcare systems of the future, I do share this approach of having more networks, more international networks. This has been repeated multiple times, and I want to restate it once more here. COVID taught us that nobody can make it by himself or herself on their own. There is always this temptation of saving by oneself. I can be safe in one city or in one region. I don't really care what happens next door, even a continent if we want to consider larger magnitudes. But the last few months taught us right the opposite. We either save us all together or nobody can be saved by themselves. And the issue of vaccines is rightly about this. We cannot really accept that there is this big inequality, this big gap around vaccines. It is not a right for everybody. It is a privilege for those who can buy it. And this is unacceptable. This is wrong in ethical terms. It is wrong with respect to the founding values of our Constitution, but it is also short-sighted in terms of our interests, because we cannot save us by ourselves. If we don't help all the other countries in the vaccination process roll out, then we'll have more variants that will have to be tackled. And the last few months showed us that from Wuhan, the virus got to Euganeo, the very small village where it started in Italy, from Wuhan to the city of Lodi in Italy and all the other municipalities of our country, even the smallest ones. That means that we are one big single international community, and that means, to conclude, that we have to learn to work more and better together. In the last few months, I went to Oxford to the G7 meeting of the health ministers, and now in Rome, the G20 meeting will be held. We have to work more together to strengthen the WHO, which is the biggest the big health organizations in the world, because health policies cannot be considered from a local perspective. It's not a community perspective, and it's not a national perspective that is needed. What we need is a larger network, a stronger network. We need something like what we have been talking about these days. We need a sort of international network that can make decisions and can also keep a kind of sovereignty that goes above the single nations, because we cannot work individually. We have to share, we have to swap opinions and experiences, and on this we really need to consider our intelligences. The true weapon that we have are our men and our women. If today we have one more chance, is that because there are scientists in different parts of the world that with their skills, with their knowledge, and with their ability to talk to each other, going beyond national borders, and this happens always at an international level, because the scientific community is a big international community by its very nature. And if today we have vaccines, if we have monoclonal antibodies that are important, it's because of these men and these women. So institutions must invest in these people and help them stay together, because in the exchange, their research can be better and can offer the answers that we are awaiting. And I believe that this is the way we have to keep pursuing more and more in a season which is a season of crisis. But as all crises, a crisis can offer an opportunity. And this opportunity now is this awareness. Let me say this quite frankly. 2 years ago, if I had asked the money, the resources for the scholarships that I had this year, I would have not been able to do so. They would have told me, Minister, what do you want to do? From 5,000, 6,000 scholarships, you want to go up to 17,000 scholarships. Who's going to pay for that? But this year we could do this. And why? Because there is a new great awareness, and now the ability of all of us, those governing the institutions, but I'm also considering institutions, voluntary organizations, the third sector, and all citizens must be that of transforming this crisis into an opportunity, because what happens is a strong tragedy, and this should never happen again. Thank you.
Mi capita in questo meeting di...
During this event, I happened to moderate political, economic sessions. We have another session about the technological transition, ecological transition today, healthcare, and I was impressed by some general guidelines. First of all is the title of this year's meeting. We cannot mention I without us. This is not rhetoric. This is about men and women committed to modern reality. The I without the we, the us, cannot solve problems. We've seen this in sport. We had many medal winners who said that it is the team that gets to victory, and this is applicable to healthcare systems, to jobs, to ecological transition. And the second term is work, labor. This I, this us must learn, must study, must know, must change. We must accept to change with more knowledge, with more investment, with more transformation. So this is the time, perhaps like in the 18th century during the Industrial Revolution, but with a more social feature. We have to change what we have lived for such a long time in a stable, static way. The labor market changes, the healthcare systems change, and so we need to use the best resources into this knowledge, this building, this working. It is a common effort. This I, which is an us, can change and knowledge. And then The third term is a term that is dear to me and to us, and it is subsidiarity. It is the common action of many things. The government, the experts, all the people collaborating, scientists, organizations. At an international level, we have heard that there is this need for new international organizations. Subsidiarity as a term is renewed, and there is this idea of horizontal collaboration. And for this effort, we need this need to get together, to collaborate, to look at the other as a good, as a possibility, but also in terms of common work. So from this encounter, there is this desire to know more, to go deeper into this, and every day you can read the newspaper of the meeting, it's Sussidiario, and about this, and this is available for free on the website of Il Sussidiario. It is a whole issue about subsidiarity. We have the contributions by Walter Ricciardi. We have many more tools, so we should not stop just focusing on today, but we have to continue by using face masks and using the vaccine and doing the tests and collaborate for a common knowledge. This is the wish of this meeting, and this is in continuity with the good debts and the bad debts that Mr. Draghi mentioned last year. The good debt is the investment that can build the future, not just for us, but for those coming in 10, 20 years, with the spirit of gratuity. What we invest today with the good debts of today will be enjoyed by our children and our grandchildren. In this sense, I would like to remind everyone that it is possible to help the meeting with the donations. So thank you all the participants for participating, and I wish you a successful meeting. Thank you.
Grazie.